With summer in full swing, hundreds of people across the country are falling victim to a parasitic infection with some extremely uncomfortable symptoms. CBS 8's Richard Allen is here with more on the search to find the source of the stomach bug and what to do to prevent it from spreading.
Well, Carlo, that's right. And the good news here, locally at least, is that so far there have been no reported cases of this infection known as cyclosporiasis here in San Diego connected with this outbreak that actually began in Michigan. In fact, the state's Department of Health so far this year has documented 41 provisional cases of this unpleasant condition here in California. But at this point, none of those cases have been linked to this current nationwide outbreak.
They invade the intestine, causing diarrhea, which can be watery, cause abdominal cramps, and may last for several weeks.
While this parasitic infection known as cyclosporiasis is not a new threat, the number of documented cases nationwide over the past couple weeks has surged, far outpacing the number of cases typically reported.
The cases that are being reported today are folks who may have been exposed 1 to 2 weeks ago.
Dr. Natasha Bagdasarian is chief medical executive for the state of Michigan, where this current outbreak originated. So far, there are more than 1,500 cases documented in Michigan, with over 40 hospitalizations, but no reported deaths. The CDC also confirms this parasite in this current outbreak has spread to 31 states so far.
For most healthy people, cyclosporiasis is miserable, but it's not dangerous.
Symptoms include stomach cramps, nausea, and fatigue.
We see some cases causing watery, often explosive, prolonged diarrhea, so even out to a week.
Health officials are still working to determine the source of this current outbreak.
Prior outbreaks have been related to produce that has been exposed to water that is contaminated with this parasite.
This infection is commonly linked to fresh fruits and vegetables, including raspberries, basil, cilantro, and lettuce. Health experts say that thoroughly washing that produce is one of the best lines of defense, as well as cooking vegetables if possible.
It's very important to know that cyclospora, the parasite, is not transferred from person to person.
Instead, it's spread through the feces from an infected person that's contaminated food or water, which can also include pool water.
You have someone or even a child who, is in the pool, they'll release it into the water, and because it is so resistant to being killed by chlorine, people who are just ingesting that water have a chance of getting it.
And those 41 cases documented here in California have been mostly tied to international travel and, again, have not been connected with this current outbreak. Carlo?
So if you come down with these symptoms, do you need to get medical attention immediately?
Well, in general, if you come down with this, most people actually just suffer through these really uncomfortable symptoms and then they recover on their own. But if the symptoms last, say, more than 48 hours, it's a good idea to seek medical attention. To diagnose this, you have to take a special test, and then there are antibiotics that you can take. But the good news is it is treatable.
That is good news. Doesn't sound like a fun thing to go
Not a fun thing.
Thanks, Richard.